You know your cat well. You can tell when they're hungry, when they want affection, when they're sleepy. But what about when they're suffering in silence? Cats are experts at hiding pain and discomfort, and often, the signs they give us go completely unnoticed. Today, you'll learn how certain behaviors that seem normal might actually be cries for help. If your cat is doing any of these things, they might be begging for attention and care. Stay with us and learn how to recognize these signs before they turn into bigger problems. And if you enjoy understanding your pet's behavior and want to give them a happier, healthier life, subscribe to our channel. We post daily videos made with care and responsibility just for you. Urinating outside the litter box. Cats are extremely clean and organized animals. They like having a specific spot to do their business, and when they stop using the litter box, it's a clear sign that something's wrong. One of the most common reasons is pain while urinating, caused by urinary infections, inflammation, or even bladder stones. In these cases, the cat starts associating the litter box with pain and looks for another place, as if trying to escape the problem. Urinating outside the box can also be a sign of stress. Changes in routine, the arrival of new pets, the absence of their guardian, or even constant noise can make a cat anxious. And that anxiety can show up physically, like changes in their bathroom habits. Another important factor is litter box hygiene. If it's dirty, smells bad, or is in a hard-to-reach spot, the cat might simply refuse to use it. Cats avoid places they find unpleasant or unsafe. Bad breath. Contrary to what many people think, bad breath in cats isn't just caused by what they eat. In most cases, it's linked to oral health issues like tartar buildup, gingivitis, or dental infections. These conditions cause pain, make eating difficult, and can become serious if left untreated. Bad breath can also be a sign of kidney disease or diabetes. In those cases, the smell may be stronger, sometimes sweet or even similar to ammonia. It's important to notice if the bad breath comes with other symptoms, like trouble chewing, excessive drooling, loss of appetite, or changes in behavior. Brushing your cat's teeth with products made for felines, offering food that helps clean their teeth, and scheduling regular vet visits are simple actions that make a big difference. Drinking too much or too little water. Have you ever paid attention to how much water your cat drinks each day? It might seem like a small detail, but this behavior says a lot about their health. Cats aren't naturally big water drinkers. This comes from their ancestors, who lived in desert regions and got most of their hydration from food. So when a cat starts drinking excessively or barely drinks at all, it's time to pay attention. If your cat is drinking a lot of water, it could be a sign of conditions like diabetes or kidney problems. On the other hand, if they're drinking very little, the risk is dehydration, and that can lead to or worsen urinary issues, such as urethral obstruction, which is a veterinary emergency. The best thing to do is observe your cat's behavior over several days and see if they're drinking regularly or not. Also, keep an eye on their urine. If it's more concentrated, has a strong smell, or if they're urinating less often, it could be a sign that something's wrong. A good tip is to offer a water fountain, which tends to attract cats more than a regular bowl, and make sure the water is always fresh and the container clean. And if you notice any sudden change in your cat's drinking habits, don't hesitate to contact a vet. Excessive scratching or compulsive licking. Every cat scratches and licks themselves. It's part of their grooming routine. But when this behavior becomes excessive, repetitive, or even aggressive, it's a sign that something's not right. If you notice your cat scratching constantly, with intensity, or licking the same area over and over again, it's important to investigate. One of the most common causes is allergies, which can be triggered by food or cleaning products. The cat's skin reacts, causing itchiness, redness, and discomfort, and they try to relieve it by licking and scratching. Another possibility is parasites, like mites or fleas, which irritate the skin and cause intense itching. Even if you don't see them, they might be hiding in the fur or around the house. And the more your cat scratches, the higher the risk of wounds, infections, and hair loss. Cats can also lick compulsively due to emotional reasons. stress, anxiety, boredom, or changes in their routine can lead them to develop this behavior as a way to self-soothe. It's like they're trying to calm themselves down. That's why it's essential to look at the bigger picture. Are the itching and licking accompanied by skin lesions, hair loss, or recent changes in the environment? Changes in meowing. Your cat's meow is one of the most direct ways they communicate with you. And sudden changes in tone, frequency, or intensity can be a sign that something's not right. If your cat has started meowing more than usual, louder, more insistently, or with sounds that are different from what you're used to, it's important to pay attention. This behavior can indicate pain, physical or emotional discomfort, hunger, loneliness, or even mental confusion, especially in older cats. In some cases, the meow may become hoarse or weak, which could be related to respiratory issues or throat inflammation. On the flip side, if a normally vocal cat suddenly goes quiet, that's also a red flag. Environmental changes, like the arrival of a new pet, someone leaving the household, or a shift in routine, can affect a cat's vocal behavior. They might be trying to get your attention, express insecurity, or simply ask for help. Discharge from the eyes, nose, or ears. If you notice discharge coming from your cat's eyes, nose, or ears, don't assume it's just dirt or something temporary. This kind of symptom can indicate an infection or another health issue. In the eyes, discharge, especially if it's yellowish, greenish, or accompanied by redness and sensitivity to light, can be a sign of conjunctivitis, allergies, or even viral illnesses like feline rhinotracheitis. In the nose, thick, persistent, or foul-smelling discharge may point to respiratory infections like feline flu, which are highly contagious and require prompt treatment. The ears also deserve attention. If you see dark discharge with a strong odor, or if your cat is scratching the area excessively, it could be a sign of otitis or a mite infestation. These problems cause pain, imbalance, and if left untreated, can become serious. It's important to check whether these discharges come with other symptoms like sneezing, coughing, fever, lethargy, or loss of appetite. These clues help determine whether the issue is localized or part of a broader condition. Regular cleaning of the eyes, nose, and ears with products made specifically for cats can help with prevention, but it's no substitute for a proper veterinary checkup. Dull coat or excessive shedding. A cat's coat is like a mirror of their overall health. When it's shiny, soft, and even, it's a sign that their body is functioning well. But when it first starts falling out excessively, looks dull, brittle, or has visible bald patches, it's time to pay attention. There are several reasons why a cat's coat might change. One of the most common is poor nutrition. If your cat isn't getting the right nutrients, especially proteins and essential fatty acids like omega-3, the quality of their fur is often one of the first things to suffer. Hormonal disorders, such as hypothyroidism or liver problems, can also show up through changes in the coat. If you've noticed that your cat's fur looks different, less shiny, falling out more than usual, or with patchy areas, also look for other signs like itching, skin irritation, changes in behavior, or loss of appetite. These clues can help you figure out whether the issue is just skin deep or something more serious. Now that you know these signs, it becomes much easier to understand when your cat is asking for help, even if they do it silently. Cats are discreet, but they deeply trust the people who care for them. And, as a guardian, you play a key role in that connection. Observing, understanding, and taking action can make all the difference in your companion's health and well-being. If you want to keep learning about your cat's health, check out the video on our channel shown next to this one. There, you'll discover other signs your cat shows in everyday life that might reveal they're not feeling well. Click and keep caring for your cat with even more awareness and love. Now tell us in the comments. Have you ever noticed any of these signs in your cat? How did you handle it? Thanks for watching, and see you in the next video.